Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Housing, Addictions and Homelessness. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Portage La Prairie.
Thank you, Honourable Chair. Yesterday, the Minister spoke at length about the importance of being honest with Manitobans about drug consumption sites and spent much of her time making partisan attacks at former PC ministers. This was odd since the same minister repeated a line she had used for years, but that she knows is not accurate. I want to give the minister a chance to retract her statement, and I table an article for the minister's education since she keeps erroneously repeating that no one has died at a consumption site. Will the minister retract her erroneous statement when presented with hard evidence, and I quote, the headline, Police Investigation, Fatal Overdose at a Supervised Drug Consumption Facility in London, Ontario?
The Honorable Minister.
Miigwech, Honorable Chair. So I don't know the circumstances under this case, and we have to go by what Health Canada tells us. So what I will share with that member is the website to Health Canada, which is healthinfobase.canada. So again, healthinfobase.canada.ca. And on their site is information from March 2020 to November 2025. And this article was from 2024, which is inclusive of these stats. So there was 0 fatal overdoses in any supervised consumption site in all of Canada, according to this database, which is Canada's database. So that member can go and look on their database. What I am happy to say is Manitoba is now included on this database, something when I was in opposition strongly advocated for. We wanted to be transparent and ensure that, you know, Manitobans knew what the numbers were in terms of how many overdoses were happening in Manitoba, how many fatal overdoses, and ensuring that we were transparent with Manitobans. We were one of the only provinces that weren't included on the map in terms of, you know, representation and being transparent. And again, I just want to preface that these are someone's loved ones, that these are people that are struggling with substance use disorders, and that these are, you know, Canadians. And we have an obligation as a government to provide services, and that's exactly what we're doing. We came into government from a failed, you know, former government who didn't take a harm reduction approach. They took one approach, which was, you know, pull your bootstraps up and just figure out yourself. And we're not taking that approach. We're taking a four-pillared approach, which includes a harm reduction approach, so we can lead people to a path of recovery. You can't lead people to a path of recovery if they're not alive. You know, it was very nice to see Bruce Oak in the gallery today. He does a lot of educating, which is a part of our pillars as well. If you go to one of the graduations, you get to see, you know, many jerseys hanging from the ceiling. And they continue to work with many of the men that have graduated from their program, many who come back and, you know, tell their stories and work with the folks that have that are graduating. And it's transformative. Like, this is work that is generational, and they're stopping a cycle. And it's because of the work of, you know, someone that's taken something that's been very tragic in their own life and turned it into helping others. Our other pillar is, of course, enforcement. We've been working with our amazing Justice Minister to ensure that we are getting the drugs off of the street and being tough on crime and the proceeds of crime. We know we can't do that alone. We know that we have to have, you know, citizens also, you know, calling in and letting us know what's happening there on the streets, and if they know about it, that they're also helping to get those toxic drugs off the street as well. So, you know, I also want to shout out, you know, our Winnipeg Police Service and our RCMP were on the front lines of that. And even our community resource officers that are in our First Nation communities that are doing that work as well. There's a lot of members that are in First Nations that have checkpoints set up to, you know, ensure drugs aren't coming in their community, because they want to keep their community members safe. They want to keep these drugs from coming into their communities. So I want to uplift all of, you know, those communities that are doing that heavy lifting for so many years in the absence of a government that, you know, a failed former government who weren't listening. But they now have a government who is, you know, putting some investments in and helping to support them, and investing in community resource officers to really help support the work that they're doing and that we're going to continue to do. And again, I want to uplift, you know, Bruce Oak and the work that they do there, because they do such amazing work, like so many of our other organizations on the front lines of this.
The member for Portage La Prairie.
Thank you, Honourable Chair. I want to let the committee know that I've had the opportunity to attend a number of graduation ceremonies at the Bruce Oak Centre, and to hear the amount of people that have gone through the program. They might have gone through the 4-month program, and it might not have always done what they wanted them to do. They were more than welcome to come back. I know we should thank Scott for his advocacy and his family's advocacy for the amount of work that he has put into treatment. And, we need many more treatment facilities like the Bruce and Ann Oak Centre. But we know the minister was aware of this incident that we were talking about with the death and others, because it was included in the Aboriginal Health and Wellness submission to the federal government for the minister's own drug injection site. Quoting from those official policies, in 2024, Canada experienced its first death at an SCS in Toronto. Should the minister get her way and subject the North Logan community to a drug site, the minister and her allies have a plan to deal with the inevitable deaths. That plan is to hide them, lie about them, and keep it from the public, all for the, quote, preservation and growth of harm reduction movement at large. The plan is to put the agenda first and to hell with the consequences. The plan isn't treatment, it's propaganda. The Premier admitted his priority for drug injection site was like an Apple store, all politics and no substance. When will the minister...
Order. So I'd like to remind the member, even if we're quoting, all of the regulations and rules around using folks' personal names or unparliamentary language still applies. So we just would omit that type of word when we're quoting.
Thank you for your guidance.
The member for Portage La Prairie.
When will the minister when the minister budgeted millions of dollars for Aboriginal Health and Wellness injection site, was she aware of this policy, and is she still comfortable going ahead with it now that the public knows she intentionally misled them about the real stats on these sites?
So just like in the chamber, using language such as intentionally misleading implies a lie. So we're going to need the member to retract that statement or withdraw it.
I withdraw that statement.
I have to recognize you first. The member for Portage La Prairie.
I withdraw that statement.
The Honourable Minister.
Thank you, Honourable Speaker. And again, I will preface that member to go back to that website, to look at that website. That is the accurate information coming out of all of the supervised consumption sites right across Canada. And again, that member continues to use stigmatizing language, drug injection site. I can assure that member that services beyond injection will be provided to whoever walks through that door, whether it's injection or consumption. And again, it's about leading people to, the right kinds of care, something that under members opposite, they did not do. We saw people, get deeper into their addictions. We saw people, encampments rise. We saw housing be sold under, the former failed government. And people having to stay up under survival mode, and get deeper into addictions because of the aftermath of what we saw under the former government. So I want to go to something our Premier said, and our Premier is right. We need to make sure that when someone walks through, into the supervised consumption site, that they have many people serving them. That, you know, whether it's primary health care, whether it's a mental health worker, whether it's, you know, they need to have someone supervising them so that they don't overdose and lose their life, that those services are going to be there, that there's a primary health care provider there. This is going to be a health-led model, that the safety and security of Manitobans is at the forefront of all of the work that we're going to be doing at the supervised consumption site. And that member knows, that member was at some of the consultations, and that member had an opportunity to sit at the table from the community consultation that was held by the community. He was invited to, you know, participate, but chose not to. I'm not sure why. But, you know, I attended, I participated, as many others did, including the Winnipeg Police Service, who is a community partner and is working alongside, because they know the value that a supervised consumption site is going to have in supporting and meeting people where they're at. Because right now it's unsupervised. We're seeing people, you know, using in parks, in playgrounds, in businesses. And Manitobans don't want to see that. Manitobans want to see people get the medical care that they need. They want to see people not using unsupervised, but being in a place where it's medically staffed, and building relationships so that when they are ready, they can get onto a path of recovery. And that was not happening under the former government. We're going to continue to put services into the system that support and meet people where they're at. We opened up the first Indigenous RAM clinic, which is led by Aboriginal Health and Wellness, who have decades of experience in the community providing health care. We're supporting mobile overdose prevention work that, I might add, you know, the member opposite continued to bring up that in the chamber about them being parked at Logan and Main Street. 10 people in January overdosed and almost lost their lives at that very place. Those folks are doing life-saving work. Had that mobile overdose prevention site not been there, 10 people would have lost their life. Would that member been okay with that? I think not. So, you know, when that member's talking about life-saving work that people are doing on the front lines, you know, we value that work as a government. We're going to continue to work with them, stand beside them, uplift them, and ensure that Manitobans get onto a path of recovery. And that's exactly what we are working towards. In the absence of this, we're working with our service providers, and we're going to ensure that a supervised consumption site gets open here in Manitoba, not a drug injection site, as the member keeps referring to. And his own leader in estimates last year said, language matters. So that member should get on board and start using the proper language like everybody uses right across our country, because it isn't just a drug injection site, it is a supervised consumption site where people are not only using injectables, but they are using other substances under a supervised medical model so people can get access to supports that they need.
The member for Portage-La Prairie.
Thank you, Honourable Chair. So I just want to clarify a couple things here regarding the consultative event that went on at Papanga Restaurant that Norbert, and I apologize, I can't remember his last name, asked me not to sit at the table because the minister was there and he didn't want a bunch of back and forth. I took his advice and I did not. I spoke to the media. That was the same meeting where the question was asked of the Winnipeg Police Services of what the plan was. What the plan was for this drug consumption site. And she said, there is no plan. So I just want to go back to where we were. So I'm going to, is the minister implying that her application to Health Canada was fraudulent? As I have part of the protocol here. Again, in 2024, Canada experienced its first death at a SCS in Ontario after 21 years of having sites operational. Please be aware that only paramedics or the coroner can declare an individual dead. This was what I was speaking of. So again, I have your website. We have this here. So does the minister still stand by that there has never been a fatality at an injection site in Canada?
The Honourable Minister.
Miigwech, Honourable Speaker. So, where to begin with this? I'm just, you know, the member opposite, again, I want to tell that member to go to the Health Canada website, you know, 0 overdoses in any of the supervised consumption sites. Aboriginal Health and Wellness, you know, is doing amazing work. They have decades of experience and trusted relationships in the community. They are the ones that are going to be operating the site. And they've done amazing work at, you know, putting together a comprehensive, amazing, you know, plan. And I don't know if that member, you know, has bothered at any of the consultations to pick up that, you know, consultation community safety plan and looked at all of the partners that are involved in that and all of the work that's been done, you know, bringing those folks to the table and making sure that people are supported, that, you know, if there are issues, that who is going to respond, and it's going to be a community response, and that, you know, there's so many people that are going to be helping, supporting, and ensuring that people are well supported from a health model, from a, you know, a policing model, that we're all partners, that we're all sitting at the table, that we're all supporting one another, that we're all collaborating. You know, I know the former failed government couldn't do that, couldn't get at the table with the, you know, municipal government, couldn't get at the table with the federal government, couldn't get at the table with any of the community partners, you know, was always picking fights. We're not doing that. You know, we're working collaboratively with all of our community partners. We're all rowing in the same direction. We all are working collaboratively because we want the same thing. We want to support people well. We want to ensure that people, you know, get the supports and services that they want. Nobody wants to be addicted to, you know, substances. It's based in trauma. And, you know, the former government didn't provide the supports and services that these folks needed, that Manitobans needed. Instead, what did they do? They sold off housing. You know, the basic minimum that Manitobans need, you know, it's It was unfortunate. You know, one transaction, 365 units gone. Took seconds. You know, it's taking us, you know, years to play catch up. But we're listening, and we know that it's not just about, you know, putting people in houses, it's about wrapping around the supports. These are folks that need addiction supports, that need mental health supports. And, you know, for that member to say that, you know, the police aren't doing their job, that they aren't doing it well, and like, you know, attacking them, like, you fired 55 officers when you were in government. We're hiring those officers back. You know, and then you talk about safety in the community. Like, we're playing catch up. We're trying to figure this out and work with community because of what you've done.
I'd just like to remind all members that comments and questions need to go through the chair. Thank you. The Honourable Minister.
Miigwech, sorry, I apologize for that. I get very passionate about this, and you know, it hits close to home, especially in Manitoba, because we hear it, we see it, we feel it, and you know, we're working with police officers. And when I hear members opposite talk about, you know, those on the front line and, you know, attacking them, you know, they're doing amazing work. They're doing amazing, amazing work, and we're going to continue to work with Aboriginal Health and Wellness. We're going to continue to work with Main Street Project. The member yesterday, you know, I don't know how he sleeps, you know, made the remark that we shouldn't be funding Main Street Project. Like, they do amazing work. How many beds would, you know, how many people would be put on the street? How many people would be put on the street if we were to not fund them? Like, incredible how that member, you know, insinuated yesterday. So I want to go back to one other thing yesterday. Somebody reached out to me about the language that was used around ghetto sizing and calling Manitoba Housing projects. That stigmatizes. That, you know, marginalizes people. And, you know, that member never apologized for that. So hopefully that member will apologize today.
The member for Portage La Prairie.
Thank you. Okay, the minister is admitting her application is fraudulent. That's good to know. I want to, Shane Sturby Highfield called a friend and asked for help getting into a RAM clinic in 2021. And I just want to set the record straight that all the RAM clinics that have been started here in Manitoba have been started by this PC government. From there, he went to a detox center and the Bruce Oak Recovery Center. It was his third time accessing treatment services. And I quote, "I guess I really had to be ready. I really had to be ready for a life change." End quote. He has been sober since, thankful for the culture of hope at Bruce Oak, and sharing his message to others struggling with addiction. And I quote again, "Reach out for help. It's never too late." End quote. The recovery model works. Access to treatment works. Every RAM clinic open today was initiated by the former PC government. In 17 years, the NDP opened 0 clinics. And since taking office again, the minister has opened 0 clinics. We have hard evidence that treatment works, that it saves lives, and it gives Manitobans their lives and their loved ones back. In 147 pages of the budget, RAM clinics aren't mentioned a single time. Can the minister explain where in either the budget or her estimates book funding is outlined for a new RAM clinic?
I'd just like to ask the member if you were quoting from a private or public document. The honourable member for Portage.
Sorry, media reports.
The honourable minister.
Miigwech, so while we were waiting for my staff to find that information, I just wanted to, yesterday, while I was introducing my staff, I failed to introduce one of my staff because I didn't have their information. So I did briefly introduce them, but I wanted to give you their full CV because they're so amazing. So Jorge is on the end there, and Jorge is currently working as my special assistant. The role he's held since November of 2024, and he brings multiple years of experience working in the private sector. He's spent 7 years working with Canadian Pacific Railway as a manager in rail operations and intermodal transportation. Prior to that, he worked in agriculture field, where he spent 5 years working with international clients in food production and crop inputs. He's also worked for the City of Winnipeg as an executive assistant for former city councillor. And he has diverse experience along with his management and logistical background, which serves him well in his current role. He holds a Bachelor of Science degree with specialization in plant psychology from the University of Manitoba. And he does amazing work in my department. So I just want to go back to that application. And again, it's Aboriginal Health and Wellness who is the applicant of that application. And again, I want to tell that member to go back to healthinfobase.canada.ca for that information. 0 overdoses in any of the supervised consumption sites in all of Canada. I want to go back to Scott Oak and the amazing work that they do and the funding, that we provide to them, because we uplift them for the work that they do, the transformative work, which is why we are investing also in the Ann Oak Foundation, and we are looking forward to that opening up so that they can also serve women and their families. We know that that's a huge barrier to women accessing treatment and recovery, and we take a balanced approach on this side, unlike the failed former government who took one approach, and that was pull up your bootstraps and figure it out. We're meeting people where they're at. We opened up the digital front door, RAM front door, so people can access services anywhere they are in our province. Whether you're in the north or you're in Portage la Prairie or, you're in the south, you can access services. And, we want to make sure that people can also get withdrawal management services. So we provided funding to Kim. So they have a van that they provide healthcare services out, and they go into a bunch of First Nation communities. They're in Thompson as well, providing services to folks out there. I remember going to, their unveiling and listening to folks who had already accessed their services and listening to their stories and their testimonials, and just the incredible life-saving work that they're doing in terms of providing a service to people, a service that wasn't there and that was much needed. And I think about, those folks that were often not thought of under the former government. And, we're a government that's listening. We're putting more services into the system because we want to ensure no matter what service you need, that service is there, that there's a no wrong door policy, and ensuring that folks are getting the right types of service. And that member, said that we didn't open any RAM clinics. We opened up the first Indigenous-led RAM clinic in all of Manitoba, and I want to celebrate that. I want to celebrate Aboriginal Health and Wellness and the work that they've done, because they've done incredible work, and they're a model that is replicative of others, across the country, because they are moving people along a continuum. They've helped people get into treatment and recovery. I've visited their site many times, as I have other sites, and I don't know if the member opposite has ever gone to visit a RAM clinic, but if he has, great. I've gone out to the one in Brandon as well, and we're going to continue to support and meet people where they're at, including youth. And I know that member across the way, we're opening up a huddle in his community so that we can help and support youth and make sure that youth have health care and mental health supports right in their community, something they never did.
The honourable member for Portage.
Thank you, Honourable Chair. The minister can't point to a single new RAM clinic because she hasn't opened a single new RAM clinic. She just cut the ribbon on our initiative. I want to point out that the RAM clinic in Portage La Prairie is on 4th Street Southeast, just across from the current Portage Hospital. I've spent much time in the RAM clinic in Portage La Prairie. I also want to extend a welcome to Jorge, a former Aggie, and like myself, so thank you, welcome. So again, I feel that I have to ask this question again because we didn't get an answer and Manitobans deserve an answer on this. So I'm going to go right from the start again. Shane Sturby Highfield called a friend and asked for help getting into a RAM clinic in 2021. From there, he went to a detox center and the Bruce Oak Recovery Center. It was his third time accessing treatment services, and I quote, I guess I really had to be ready. I really had to be ready for a life change, end quote. He has been sober since, thankful for the culture of the hope at Bruce Oak and the sharing his message of others struggling with addiction. Another quote, reach out for help. It is never too late, end of quote. The recovery model works. Access to treatment works. Every RAM clinic open today was initiated by the former PC government. In 17 years, the NDP opened 0 clinics, and since taking office again, the minister has opened 0 clinics, except cutting the ribbon on the PC-initiated RAM clinic. We have hard evidence that treatment works and that it saves lives and gives Manitobas their lives and their loved ones back. In 147 pages of the budget, RAM clinics aren't mentioned a single time. Can the minister explain where in either the budget or the estimates book funding is outlined for a new RAM clinic? Thank you.
The honourable minister.
Miigwech, Honourable Chairperson. And again, I want to correct that member. We opened up the first Indigenous-led RAM clinic with Aboriginal Health and Wellness. They've been doing amazing work. We are investing $8.4 million for RAM, and we're going to continue to support, and we've expanded a $1 million expansion in 25-26. RAM, I'm happy to say, has capacity because of all of the investments that we've made. Whether that's withdrawal management, whether that's opening up, more detox beds, whether that's, ensuring that we have withdrawal management services, whether that's digital front door. We've made so many investments that the former government did not make. They weren't meeting people where they're at. And I can tell you, Your Way Home has made a huge difference in terms of supporting and meeting people where they're at. Folks that might have gone deeper into their addictions are now being supported in their homes and may not have to go to treatment because they are getting supports in their homes, and they feel a sense of hope, something they didn't feel under the former government. Living in a tent, undignified with a former government that didn't provide any housing. In fact, left boards on over 2,100 units. I used to remember driving by 7-Eleven Dufferin, where I raised my 2 young sons as a single mom for part of my life, and being so upset that those units were boarded up. When I would see people, homeless in encampments, I would go visit the shelters, and I'm going, what's wrong with this? What's wrong with the PC government? Why aren't they getting these boards off these units when we have people who are homeless that need these these housing units. And, you know, I was on the other side always advocating to get more housing online, but, you know, the former government wouldn't listen. Instead, they were selling off, they were de-investing, 87% de-investment. They were firing staff in Manitoba Housing. They were firing security guards, the very people who kept, you know, the community safe. They were firing tenant service coordinators that, you know, helped keep community in the buildings, and they weren't putting maintenance into the buildings. And yesterday, the member talked about Stevens, you know, and they talked about Oak Tree. We're making significant investments in that member's own backyard. So they should be thankful that our government is investing in their community and right across, you know, Manitoba. And I want to remind that member that they don't just represent their community, they're the critic for all of Manitoba. So, you know, when they're going back to their caucus and they're sitting at that table, that, you know, when I was in opposition, I was always advocating for all of Manitobans as a critic because, you know, housing is needed right across, you know, our province. And we know that it's a social determinant of how well people do, which is why we are making sure that we are not only putting people in homes, but we are providing the proper supports to them. And I want to go back to the number of overdoses under the former government. In 2022, there were 459 people, you know, these are someone's loved ones that overdosed, that lost their lives. You know, there were families that were knocking on that government's door, asking for help, asking for support. There was a report that was given to the former Premier Brian Pallister, and he flippantly just threw it on the ground like it was nothing. And that came from medical experts, people's you know, medical expertise that were put into that report. And you want to know what else? Like, it was taken out. And then that report was rewritten, and then it was submitted. Like, it was hidden in a second report, like the audacity. And then we had another minister that said that they went to Vancouver and they went into the supervised consumption site, but turns out that they just walked by and gawked, took some pictures, came back, and then that came out in the media. Like, that's the kind of former government, that's why they're on that side.
Member for Portage La Prairie.
Thank you, Honourable Chair. First thing I want to say is that I wasn't the former critic for addictions and homelessness. I'm the current critic for homelessness and addictions. All people in Manitoba, I don't represent just my community or any, I represent all Manitobans. And the addictions and homelessness portfolio, I'm trying to give it as much, I am giving it all of my attention. And again, the minister cut the ribbon on initiatives that started under our government. By the minister's own admission, the most successful part of her addictions portfolio is a PC initiative. And I want to talk, you know, the minister mentioned, I believe it was in 2022, 459 overdoses. I also want to talk about the amount of RAM clinics that this PC government opened, because again, the only thing that the minister has done is cut the ribbon on our initiatives. So can the minister answer why in 2.5 years she hasn't allocated a single cent for a new RAM clinic? And if there is, where is that new RAM clinic today?
The Honourable Minister.
Miigwech, Honourable Speaker. That member is taking credit for work that is done by Aboriginal Health and Wellness. That is the credit of the work that they are doing to move people into treatment and recovery. Aboriginal Health and Wellness is the one that is running the RAM clinic. We as government will never take, glory for the work that frontline organizations are doing. That is their work. So for that member to, try to pipe themselves up, lift themselves up, say it's our government that did this, our government and did that. We'll always take credit for making investments, absolutely, but they are on the front lines doing the work. So I'm going to give them credit for the work that they're doing. And yes, we came in and we helped support and, get that through the line. But I want to remind members opposite that, they said they were going to do this, they said they were going to do that in their just before the election, they were starting to make investments. They were desperate. They were so desperate. They were making all of these, promises to Manitobans that they didn't even have the money to pay for them. They didn't know how they were going to pay for them. And I want to remind Manitobans that, no one can believe what members opposite say. They have a leader who lied. I withdraw that. I withdraw that comment. They have a leader who said they said something and, later was shown by the media and in video that it was, in fact, they said it. And that member across the way sits beside them and still, chooses to support them. So what I will say is, in 2023, there were 568 Manitobans who lost their lives. And we need to focus on, supporting and uplifting and making sure that investments are being made, and we are doing that work. We're going to continue to do that work. The Auditor General in 2023 reported that the former government turned away over 1,200 people from RAM clinics in one single year. 1,200 people. In 2023, their redirects from RAM clinics were approximately 70%. You know how much that is down now under our government and the work that we've been doing in consultation and collaboration, and because we're listening and making investments, because we're listening to communities and working in collaboration and working with community organizations and on the front lines and listening to what is needed and filling the gaps that should have been filled under the former failed government. 28%. 28%. That's something to be celebrated. And you know why we're celebrating? We're celebrating the work of the organizations on the front line who have brought that number down. They've brought that number down. Their work has brought that number down. Not our government, it's our investments, yes, that they've told us that need to happen. Because they're on the front lines that are telling us that there's gaps. We're not doing the work. We're not on the front lines doing the work, so we're not going to take credit for it. But we will ensure that if we have the funds and we're going to be fiscally responsible about doing that, that we will make the investments. Unlike members opposite who wouldn't make those investments. We're going to continue to support Manitobans and ensure that the supports are there. And, these are somebody's loved ones. We can't, take our foot off the pedal. We can't continue to pat ourselves on the back like the former government did and say, just pull your bootstraps up and figure it out. It needs to have a balanced approach, which, like I said, includes harm reduction. You can't lead people to recovery if they're not alive. You can't lead people to Bruce Oak if they're not alive. Education. Bruce Oak is educating people. He's doing it the right way. He's supporting and meeting people where they're at. And we're also doing enforcement, working on getting the drugs off the streets. So I invite members opposite to get on board.
The member for Portage-La Prairie.
Thank you. Why does this minister think I've been advocating for constituents that she has refused to? I remind her she wouldn't meet with the Point Douglas community until we brought them into the legislature. This is shameful. End Manitoba, End Homeless Winnipeg says there are 8,248 people using shelters, temporary spaces, or living on the streets as of the end of March. End Homelessness says the numbers of people entering homelessness is outpacing those able to secure housing, with 104 newly homeless people in February and March. When will this change? How will this change? Again, working with people in the Point Douglas area over and over and over, and we will continue to do that. We worked with Aboriginal Health and Wellness on the RAM clinics. We didn't just cut the ribbon on one. I think the minister just answered her own question saying that 1,200 people have been turned down at RAM clinics. Does that not mean that we need more treatment centers out there? I don't see anything out there at this time. And again, why? Why is that not happening? Why is this minister not meeting with the people of Point Douglas? The last time the Premier met with the people from Point Douglas, they come into our office after crying. The people of Point Douglas are trying to make a difference in their community, and this minister wants to put a drug injection site across from a business called Papanga. The family from Papanga come in to the minister's office, and what did the minister offer them? An application for a $2,500 security rebate. Is that not saying you're going to have trouble in your area, but here's a $2,500 rebate? How is that fair to the people of Point Douglas?
The Honourable Minister.
Miigwech, Honourable Speaker, and I don't know if that member is not listening to the answers that I'm providing, but under their former government, the Auditor General in 2023 reported that their government turned away 1,200 people from RAM clinics in a single year. Under our government, and working collaboratively with RAM folks and the clinics right across our great province, this has come down to approximately 28%. So again, from 70% to 28% because of the investments that we are making, because we are listening to those on the front lines that are telling us this is where investments need to be made. It's making a difference. And it's not just about, investing in RAM clinics, as I've said. The PCs forgot about folks in the north, they forgot about folks in the south, they forgot about rural folks. Like, they left a whole population of people out. They were about just pull your bootstraps up, figure it out, and people can't get to treatment and recovery if they're not alive. And we need to ensure that there's a whole, suite of services for people, ensuring that there's someone there that's providing care, compassion, and support. And not everybody's at that point where they are willing to go into treatment. Today might not be the day, but if they have someone that they're building a relationship with, that maybe tomorrow is. So I want to go back to language again. That member keeps using drug injection sites. Again, we're providing, more than injection. We are providing, if someone is coming in and doing inhalants or ingestibles, we want to ensure that we are keeping people alive. It's about providing a medical, supervised consumption. So people can, if they're, if they need that support is there. And again, Aboriginal Health and Wellness, they are all they come from a medical background. They operate the RAM clinic at Neeganan Centre, which is the Aboriginal Centre. That member is more than welcome. I'm sure they would welcome him there. It's at Higgins in Maine. They also have a primary health clinic that's right beside it. So many people right across Manitoba go there, whether they live in the south, whether they live in the north, east, people go there from all across Winnipeg. And, you know, again, like addictions touches everyone, you know, regardless of your socioeconomic background, regardless of your gender, regardless of your race, like it touches everyone. So I want to remind that member that like we have to ensure that we are not stigmatizing and that we are ensuring that people are getting the supports that they need and that we are taking a balanced approach. Again, you can't lead people to recovery if they're not alive. And right now, people are using unsupervised. They're using in our school grounds, they're using in our playgrounds, they're using in our businesses, and people don't want that. People want to see someone going into somewhere to get access to supports with medically trained staff and on to a path of recovery. And they're not going to do that if there isn't the supports there. I want to go back to, you know, meeting with Point Douglas folks. My door is always open. My phone is always on. I am always accessible to anyone and everyone. My community knows that. Manitobans know that. I've never, ever not had my door open to anyone. So I've met with those folks multiple times. I've had how many consultations? When they had community consultations, I showed up every single time. Can I say that they were easy? Nothing's ever easy, right? This job isn't easy, but we show up each and every day because we want to make Manitoba a better place for everyone. And we're here to serve everyone. That includes people who are, you know, struggling with substance abuse. Nobody wants to be addicted to substances. It's based in trauma. And we have to ensure that we are serving all Manitobans, including those. And, you know, that member keeps stigmatizing and leaving those folks out. And I wish that member would, you know, start to talk about what other supports and how we can work together to ensure that we are leading people to those supports.
The member for Portage La Prairie.
Thank you, Honourable Speaker. I will cede the next question to the member from Spruce Woods.
The member for Spruce Woods.
I would like to talk about your housing situations and moving addictions, homeless, I'm not sure, people into senior housing in our small communities in rural Manitoba. I've been told our 55 plus is no longer a 55 plus senior home. It was for disability, senior people. Now we have many addicted people in their 20s, 30s living in this home. The seniors are so scared. One incident, they were running up and down the hall, young gentlemen asking for sex, for many of them fully naked. This has never, my grandmother lived in these homes for years, and it was a beautiful home, beautiful. It is no longer that in Souris. And I've had several family members of these residents that are living in the house. I've had talks with counselors and whatsoever. I like to know when this policy changed and why they are being sent out into these safe place for seniors.
The Honorable Minister.
Miigwech, Honorable Speaker. So first of all, I just want to let the member know that safety and security is our #1 priority. I know the member wasn't, well, yesterday, I know I can't say if you were present or not, but yesterday I talked a lot about safety and security in our buildings, and when we came into government, the state of our buildings and the state of security, and how we've reinstated and really worked hard to turn the ecosystem of our buildings around and reinstate once what was there in terms of community and helping people come out of their units. And certainly if that member does have casework, we would certainly like to meet, and my department's more than willing to hear that and figure out how we can address that. We haven't got any casework to date on what that member has brought forward, so I asked my team to look into, that we know of, to look whether we've received anything into our office around Souris. Under the previous government, what I will say is that buildings that were 55 plus were, that policy was changed under the former government to allow people who were under 55 to be tenanted in those buildings. We have since started turning that back to 55 plus buildings, because we've heard loud and clear from folks who are living in our buildings that are 55 plus and older that they want to have a seniors building back. So we've started to do that work. We're probably, I don't know, a third of a way turning our buildings back, maybe even halfway at this point, but certainly it's been a lot of work for our department to ensure that people that weren't 55 plus had somewhere that they wanted a desirable location to move to. And seniors are a priority for us to ensure that they have safe place to live, that they have an affordable place to live, and we know that a lot of them are on a fixed income, and that they have someone that's their loved one that wants to ensure that they are taken care of and they can age in place. And that's certainly something that our government is well aware of and is a priority for us. So we're ensuring that we have housing dedicated just for our seniors. So if that member wants to, after here, let us know about that casework, we would certainly look into that and do that work. But again, I want to go back to the state of housing when we took over, and going into, I think about the Kennedy Strip, and we're going to be doing there's going to be an announcement in the next month on some things that are coming out of the incredible work that's been done in that strip. And I remember visiting, many of our buildings and just seeing the state of it, and I felt like I couldn't believe the state of it. I went into one suite, and then there was a hole into the next suite and a hole into the next suite, and people were living in there. And the former government, were allowing people to do suite takeovers. And, these families were still living there, and they didn't have any, recourse. And when we came in, we changed that around. We hired back security guards. We put in a monitoring system so that we can monitor all our buildings, and we have 24-hour a line that folks can call, and there'll be a response, and we can also provide you with that number as well for those folks. We did a lot of upgrades and maintenance in our building because people like to take pride in their housing. We did a lot of that work. We hired tenant service coordinators to really change the ecosystem so that we were building community rather than folks being afraid to come out of their suites. And we did a lot of upgrades. And we're continuing to work with community.
The member for Portage.
Thank you all.
My apologies, but. My apologies.
Chair, I just want to,
Sorry, I have to re-recognize you because I wasn't sure which member. So the member for Portage La Prairie.
thank you, Honourable Chair. I just want to talk about the great work that was done. When we talk about Manitoba housing units, when we talk about security there, I can talk about, Oak Tree Towers in Portage La Prairie and, what those people went through there. But the other thing is where they were most frustrated was there was a security firm there. Then there was a security firm gone. Then there was a security firm there. Then they were gone. These people didn't know if the security was going to be there 24 hours a day, if it was going to be 12 hours a day. And even the security firms, which I spoke to myself, they didn't know from week to week, from month to month, if they were going to be there. So one of the questions, again, I'd like to ask the minister is the security now that is in the Manitoba housing units, is that full-time now? And will the minister come forward that it was because of the initiative and the work that we did for all the PC government, for all the people that were living in the Manitoba housing units? The minister talked about schools. Aboriginal health and wellness application included a plan to hang posters up in schools advertising the drug injection site. Is this still the government policy? And the reason I ask that is from the consultative process that we were at. The question was asked are people going to be asked for ID that come to the drug consumption site? The answer was, at that time, we are going to be, we need to develop a relationship with people first. So we will ask people for their ID. If they don't have their ID, that'll be okay. It's part of that relationship building. So my question is, how do you tell if a kid is 15 years old, 18 years old, 12 years old, or 20 years old? And if we are not asking for ID, so has this policy been changed? Will the safe consumption site, will it be asking for ID of everyone that comes through the door? And if someone does not have ID, will they be allowed in the door? And how will this government plan to make sure that they are not enabling kids that are under 18 years old to access a drug consumption site?
The Honourable Minister.
Miigwech, Honourable Chairperson, and I will go back to, remind that member that he does represent all of Manitoba. And, he keeps referring back to, his constituency and the housing there. And again, I want to remind that member that there's been deep investments because of this government. And members on the other side, when they were in government, 87% slash in maintenance budget. 87%. Boards up on, thousands of Manitoba housing units, thanks to their failed government. Our government took those boards off of over 2,100 units. We are making investments to bring buildings up to code. And I want to remind that member, fire life safety, exterior, interior, making sure that there's cameras, swipe cards, doors that actually work. Under that former government, those members at Oak Tree Towers were asking for those investments since 2021. They were in government then. Why didn't they do it? They didn't do nothing. They de-invested. They fired staff. They fired security guards. They didn't put money into any of these buildings, and they have the audacity to come here and talk about their good work. I want to remind members opposite that they didn't build one single unit of social housing. They're talking about the number of people who don't have housing today. That's because of the work that members opposite did. No work, zero work. You didn't provide housing to Manitobans. You put Manitobans in the street. 385 units in one transaction.
Just a friendly reminder to all members, all questions and responses need to go through the chair. The Honourable Minister.
Thank you for that reminder, Chair. There was no investments made on that side from that member's government. And that member wants to say that they weren't a part of that government. Well, that member ran for that government. So that member is a part of that government. So if that member thinks that they can run away from their government's record, they can't. They're running with that government. They ran with that government, they're still with that government. They can't run away from that government's record. So don't think that you can hide from what they did and continue to do. These are people that needed homes, that needed support. So I'm going to go back to the question you asked about youth. Youth need support too. And I've said this in the House. If a youth that is under 18 presents through the chair, if there's a youth that presents at the supervised consumption site that is under 18.
Apologies. Just need to remind all members that the language needs to go through the chair to avoid the word you. The Honourable Minister.
Thank you for that reminder, Chair. I want to go back to the question that, the other question that was raised around youth presenting at the supervised consumption site. And we've been explicitly clear, and I don't know how any clearer I can be with that member. And our Premier's been clear about this. If a youth presents at the supervised consumption site, they will be referred to the appropriate service. There are huddles, there is RAY, and there are a multitude of other services that are provided to youth. There are youth that struggle with substance use in this province that need supports as well. Is that member aware of that? Is that member aware that there are youth that struggle with substance use that may lose their lives as well? We have a responsibility to provide services and supports, and the supervised consumption site is not appropriate resource or support or service for these youth, and we've been very clear that this will not be serving youth. So if a youth does present there, they will be referred to the appropriate service. So that member needs to, I don't know what they're trying to get at. And then back to this poster that we're supposedly putting into schools, I would ask that member to table that poster, because I'm an educator and I've talked to many teachers, I've talked to many principals, I've talked to superintendents. Nobody knows about this poster that the former failed government is supposedly talking about. So through the chair, I would ask for that member to table that poster.
The member for Portage.
I will cede the chair to the member from Fort Garry till the end of the day.
The member for Fort Garry.
Thank you. It was reported today that frontline workers are asking the province to declare a public health emergency. In fact, they've described it as a spring surge in overdose deaths. One longtime activist described as the worst spring they'd ever seen. And it appears the issue is an unstable, unpredictable, potent drug supply, specifically drugs being cut with a veterinarian tranquilizer that naloxone doesn't have any sort of effect. And this is causing basically an overdose epidemic. It's been fatal. And I've been listening very carefully to the minister's comments this afternoon, and I reviewed her comments yesterday. And I have some concerns about this because at one point the minister lectured the opposition critic about the need to take a harm reduction approach, quote unquote. Yet yesterday the minister came out on the record and said that she was opposed to safe supply. And I'm wondering how the minister doesn't choke on the hypocrisy of that. Safe supply is a harm reduction process. The BC chief medical officer is in favor, so is the BC coroners, as well as many experts in healthcare, as well as those people with lived experiences. It does two things. It gets rid of the drug dealers. I've certainly had the privilege to meet the minister's constituents and have done a walking tour of North Point Douglas, and I've seen the drug dens, I've seen the trap houses that are just feet away from schools and childcare centers. And the concern, because I don't think the minister understands her own constituents, is that her neighborhood is become a marketplace for illicit drugs currently, and nothing's been done. And these drug dens and these trap houses are right next to family homes. And the concern is that these people have to get their drugs somewhere to use them in a safe consumption site. And they will continue to use North Point Douglas, which has become the de facto market town for illicit drugs in the area. And what a safe supply does is get rid of the drug dealers. You don't need them anymore. You don't need trap houses. You don't need drug dens. The other thing that a safe supply does is it makes sure that your drugs aren't cut with veterinarian tranquilizer and killing people. This is an expert-driven solution that saves lives. So it's one thing for this government to lecture the opposition about this and turn around and copy their arguments. So I'll ask this minister, on what principle basis is she opposed to safe supply?
The Honourable Minister.
Miigwech, Honourable Speaker. Where to start on that? For the member to, make the insinuation that I don't understand my constituents. Well, I'm someone who grew up in my constituency, who, has family who still lives in their constituency. I don't drive a Mercedes. You know, I don't collect 2 salaries. You know, I connect every day with my constituencies because that's where I come from. I never forget where I come from. You know, I'm there on the front lines, connecting every day with my constituents. So, you know, can I say that to the members opposite? Yeah, you went on a walk in my community. Good for you. How else do you give back to a community? You know, there's people struggling every single day that need supports and services. And you can be on this side of the house advocating, supporting, helping to meet people where they're at, helping us to get a supervised consumption site open, helping us to build some more housing, helping to get more people with influence to the table to support getting more housing built, to get more wraparound services provided. Instead, what is that member doing? He's on the other side of the table, you know, fighting against something that should be something so simple to get people the supports and services they need so desperately. And yes, we are taking a harm reduction approach, which means we need to get people onto a path of supports and services. And it's one of the many options, you know, one of the many harm reduction methods that we're taking. And we've been very clear, we're not doing safe supply. We are working towards opening up a supervised consumption site. That is our focus. Manitobans have been clear with us, knocking on doors, talking to businesses, talking to those who are struggling with substance every single day. And they want somewhere where they can not see people unsupervised, losing their lives in their businesses without any supports. That is our focus, to get a supervised consumption site opened. We're, you know, investing in, you know, many different ways. And as we talked about, you know, justice is, you know, the meth task force, another tool. We're working on getting the drugs off the street. You know, these are harmful drugs. They're taking people's lives. I've met with so many parents. Do I want to keep meeting with parents? No. Do I want to keep meeting with loved ones? Absolutely not. That's why we need to open up a supervised consumption site. Parents have been asking for this. This is what they want. Families want this. It's going to be a medically led model. It's going to be very different from what we've seen in other jurisdictions in terms of safety, security. We're working with policing. We're working with Downtown Community Safety Patrol. We're going to have wellness workers that are supporting folks. There's going to be folks that are helping folks with their mental health, which we know that is a huge driver why people are using substances. But we also know that housing is, you know, a stability, a social determinant of how well people do. And we know that people got driven into addictions because of the former government selling off housing and not providing, you know, the adequate supports. So we're going to continue to invest. We're going to continue to take a full 4-pillared approach. And harm reduction is about leading people to the supervised consumption site, where there is going to be medically trained staff that are going to help and support from a harm reduction approach, which is going to be a supervised from a medically trained staff. And it's one more tool that we can use to support along with you know, our meth task force. And I want to remind that member, like, I grew up in Point Douglas, so for that member to say I don't understand my constituents or understand where I come from, I was born and raised there. Like, can that member say the same?
The member for Fort Garry.
You know, I think it's concerning and troubling that the Minister of Addictions for the province of Manitoba is unable to defend the policy statements she makes publicly. That when given the opportunity to articulate why she's against a safe supply, she cannot do it. She does not have an explanation. She cannot defend her position or her government's position. Manitobans should be concerned when policy occurs that way and the government has no rationale behind it other than, well, just because. But I'm going to turn now to October 2024. The Canoe government handed over $10 million to a private for-profit real estate investment trust to invest in affordable housing. Manitoba taxpayers on the hook for that money. We have no equity stake in it, meaning we're never getting it back. And if that money is used to make a profit, Manitobans won't profit from it. So it appears the idea is that investors will bring that money to build more units and try to profit off those units. Now, on October 8, 2024, the CBC interviewed this minister who claimed that that initiative would have 3 housing projects up and running that year. Well, it's been over a year, no housing projects, not 1, not 2, not 3, none. A year later, October 7th, 2025, the first time True North Sports and Entertainment says they're going to come up with $5 million to invest in this trust, and another foundation is putting in $2 million. Problem for that is that this is the same corporation owned by Canada's richest billionaire that the government is subsidizing the construction of True North Development Corporation. That the government has signed a 35-year lease, which won't disclose the terms to the Manitoba public, but we know that over a 35-year lifetime, the province of Manitoba will be transferring to Canada's richest billionaire billions of taxpayer dollars. That is the only company that's come forward to actually provide money for this initiative. We also know the Premier used his platform to do video promotions for a private investment for this REIT, for somebody else to make money off of that investment, and used his position as the Premier to doing it. So now I think we're 18 months in and counting, and absolutely no houses or units have been announced or built. The private sector hasn't jumped on board, hasn't contributed any money. In fact, the province's share still is the dominant amount of the money. So I asked this minister, is this program a success? And when will there be 1 unit of actual housing built from it?
The Honourable Minister.
Miigwech, Honourable Chairperson. So I don't know if that member understands what the Char REIT does, but they work with the nonprofit sector, and I don't know why that member has an issue with building social and affordable housing here in our province. And again, we are coming to the table with whoever will come to the table with us, and this is like the private sector who is leveraging funds to come and help build and support the building of social and affordable housing here in our province. And again, I asked that member earlier, you know, they have folks that they know that have deep pockets and could probably, you know, invest in this char REIT and support building. So it'd be nice maybe if they helped leverage some of their friendships and partnerships and bring them to the table and help, you know, the one-to-one dollars that we're providing. I will let the member know that we have 2 completed projects that we have yet to announce, but we're you know, awaiting that. I am, you know, eagerly awaiting when we make that announcement, and I'm sure that member will be very happy once that announcement is made. And again, it's about building up our housing stock here in our great province of Manitoba and providing opportunities for Manitobans to have a beautiful place to live. And it's about leveraging, you know, the private sector dollars to our government dollars, one-to-one. Like, why would we not want to invest and support, you know, public dollars to come in and help build housing for folks that need it? We know right across our great country of Canada, we have a housing crisis, but we're way behind thanks to the former government in terms of housing. We could have been way ahead, and you know, we had to invest all of these dollars in almost 2,200 units. Imagine if we didn't have to make those investments. Imagine if we could have taken those dollars and put those into bringing other units online or investing those into building more units. We've made generational investments in housing, you know, something we should be celebrating. We purchased 447 Webb, hundreds of units for folks that, you know, are going to have a safe, stable place to live with wraparound supports that are going to help them move on a continuum, that are going to help them realize that, you know, they can have somewhere for themselves other than a tent. It's transformative. I've gone to visit, you know, some of our other sites that are providing wraparound supports to folks, and, you know, listening to their stories of the work that and the relationship that's being built with the service providers, you know, many of whom, all of them, I want to lift up for the work that they're doing, because it's very complex and, you know, really supporting these folks and what they've had to really endure for a lot of years under the former government, and not having, you know, supports and services and being able to have somewhere to be safe and secure, and somewhere dry, somewhere warm, you know, have your own bathroom, somewhere to have your own shower, and not knowing where you're going to get your next meal. This is what's being provided now, and these folks that are providing the wraparound supports are, you know, really creating relationships to the point where these folks are ready to go into, you know, adult ed. We're making investments because we know that people want to go back to school. You know, it's generational change that we're going to see from the investments that we're making, and the folks are on the front lines are helping to create, you know, these transformative changes for these folks. And these investments that we're making with Char REIT, leveraging the private sector dollars, why wouldn't we not want to do that? And I'm looking forward again to announcing these 2 projects and more to come.
The member for Fort Garry.
Manitoba is facing a housing crisis, at the same time is facing a mental health addictions crisis. And I want this minister to succeed, because if she succeeds, Manitobans succeed, and I'm rooting for her. Problem I have is this government's rhetoric doesn't match its actions. This government says that the housing addictions ministry is a priority. But in the 2026 budget, it was one of 7 ministries to actually get a cut. when many other ministries didn't. In fact, $9 million was removed from the nonprofit housing budget. And that has incredible knock-on effects because the nonprofit housing groups were using that grant money to apply for federal grants that actually could get housing units built. And without access to those grants, they're not able to apply for these federal grants and therefore can't get new housing built. That one cut has a downstream effect of preventing housing that could have gotten built in Manitoba. And my question to the minister is, why? Of all the things you could cut, why would you cut a fund that acted as an accelerator which created funding?
Order. Reminder to all members that all questions and comments must come through the chair. The member for Fort Garry.
Why? The minister could explain she made that cut.
The Honourable Minister.
Miigwech, Honourable Chair. Could the member clarify where that member got that number from? And we're trying to look for that number and where they came to that number from.
The member for Fort Garry.
It's from the Manitoba Nonprofit Housing Association.
The Honourable Minister.
Miigwech, Honourable Speaker. I will let the member know that there has been no funding cut to the Manitoba Nonprofit Association, so I don't know where that member has got that number from. So if that member can clarify where exactly they're referring to those numbers from, line by line, then we can speak to that. But we have not made any cuts to the nonprofit housing association.
The member for Fort Garry.
All right. I will, I think we are not finishing today, so I certainly can provide a specific reference in the budget to where I saw the cut. Quickly, before time runs out today, the wait list for Manitoba Housing is the highest it's been in 5 years. When this government took office, it was 5,000 families. 2.5 years of this government is now 7,500 families. Every year it gets worse, and this government has actually gone from building 600 units to pledging about 215 this year. Why is this minister going backwards at a time that we should be accelerating to 1,000 or more units a year?
The hour being 5 p.m., committee rise.